everyone, I'm Rupal, a registered nurse. On this channel, I explain palliative care clearly, honestly, and without pressure so patients and families can understand their options. In today's episode, we're talking about how to find a palliative care in your area and how to figure out which option is right for you or your loved one. Now, before we go any further, I want you to keep two important things in mind. First, just because a company doesn't have great ratings or has no ratings at all does not mean it's the wrong choice. In many areas, there may only be one or two providers available, and some support is often better than no support at all. Second, if you have concerns about what you find, what you read, bring them up with the palliative care team directly. These conversations can help you make a better decision, and they can also help the providers improve areas where they may be falling short. So now let's walk through how actually to look for palliative care services. Step one, start with Medicare website. It's Medicare, M-E-D-I-C-A-R-E, Medicare website. Let's say you live in a suburban area. Open a web browser like Safari or Google Chrome and go to medicare.gov. Once you're there, look for the option that says Find Providers Near Me. Then on the left-hand side, you will see different categories, different options. Look for hospice and click on hospice. This part can be confusing, so let me clarify something important. Palliative care services are often provided through hospice organizations, even when a patient is not on hospice. That's why palliative care information is listed here. Your computer may ask you permission to use your location. If you're searching for the care near you, click Allow. If you are searching for someone in another city or state, click Don't Allow, then enter city or state manually. Once you search, you will see a list of hospice companies. Some will have star ratings and some may not. Which one should you choose? Here's the biggest tip. Don't get hung up on the number of stars. We talked about it. Instead, click on a provider and look at what they actually offer. Ask yourself, do they clearly list palliative care as one of their services? What type of illnesses do they commonly serve? Do they provide care at home, in clinics, or in the hospitals? The website provides a breakdown of this information, but if it feels like this is too much, it's completely okay to call them directly and ask the questions. Also ask the questions when you call, but keep it simple. Here are 3 important questions you want to ask. Do you provide palliative care services in my area? Do you accept my insurance? How soon can someone meet with us to explain palliative care and assess the patient? Write down the answers from each company you speak with and compare what works best for your situation. Sometimes none of the options feel perfect, and that's normal. Remember, palliative care is additional support. It's there to help with comfort, symptoms, and quality of life. One very important reminder, you are not signing a contract. Palliative care is a specialty service. You can stop it at any time. Just like you can change a cardiologist, a pulmonologist, or a primary care doctor, you can change palliative care provider if the first one doesn't work out. You have choices, and you are allowed to reassess those choices as your needs change. So in our next episode, we will talk about what other services can be combined with palliative care and why those combinations can make a real difference. If this video was helpful, feel free to save it or share it with someone who might need it. And if you have any questions, you are welcome to leave them in the comments. Thank you for being here. I'll see you in the next episode.